two-factor concept. Business management was built with a number of concepts. Herzberg two-factor concept was one of the major concepts among that. The two-factor theory is a concept that states the factors that affect an individual's satisfaction and motivation level. These two factors are job dissatisfaction, affective or hygiene, job dissatisfaction, motivational. Herzberg two-factor theorem was introduced by Frederick Herzberg. Frederick Irving Herzberg was an American psychologist who became one of the most influential names in business management. He born on April 18, 1923 and died on January 19, 2000. He is most famous for introducing job enrichment and motivator hygiene theory. His 1968 publication, One More Time, How Do You Motivate Employees, has sold 1.2 million reprints by 1987 and was the most requested article from the Harvard Business. Hesberg proposed the motivator hygiene theory, also known as the two-factor theory of job satisfaction. According to his theory, people are influenced by two sets of factors. The idea is that hygiene factors will not motivate, but if they are not there, they can lower motivation. These factors could be anything from clean toilets and comfortable chairs to a reasonable level of play and job security. The theory deals with satisfaction and dissatisfaction in jobs, which are not affected by the same sets of needs. Instead, occur independently of each other. Herzberg theory challenged the assumptions that dissatisfaction was a result of an absence of factors giving rise to satisfaction. Motivational factors will not necessarily lower motivation, but it responsible for increasing motivation. These factors could involve job recognition, potential for promotion, or even the work in itself. Herzberg describes the growth factors or motivators as achievement, recognition for achievement, the work itself, responsibility, and growth or advancement, which are intrinsic. Intrinsic factors include orientations towards money, recognition, competition, and the dictates of other people, and later includes challenge, enjoyment, personal enrichment, interest, and self determination. The hygiene factors or dissatisfaction avoidance, which are extrinsic to a job, are company policy and administration, supervision, interpersonal relationship, working conditions, salary, status, and security. This extrinsic factor refers to doing something because it leads to a distinct outcome, something external you expect to receive, and the latter refers to doing something because it is inherently interesting or enjoyable and internal reward. Herzberg started his research on organizations in 1950s. He worked at the University of Utah, where he remained until he retired. Prior to his move to Utah, Herzberg was professor of management at Case Western Reserve University, where he established the Department of Industrial Mental Health. In his lifetime, Herzberg has consulted for many organizations, as well as for the United States and other foreign governments. Satisfaction, putting theory into practice. Yes, it is possible for you and your employees to be happy on the job. The key is how you handle two factors, motivation and hygiene. Employee satisfaction and retention have always been important issues for physicians. After all, high levels of absenteeism and staff turnover can affect your bottom line as temps requirement and retaining take their toll. But few practices in few organizations have made job satisfaction a top priority, perhaps because they have failed to understand the significant opportunity that lies in front of them. Satisfied employees and tend to be more productive, creative, and committed to their employees. And recent studies have shown a direct correlation between staff satisfaction and patient satisfaction. Family physicians who can create work environments that attract, motivate, and retain hardworking individuals will be better positioned to succeed in a competitive health and environment that demands quality and cost efficiency. What's more, physicians may even discover that by creating a positive workplace for their employees, they have increased their own job satisfaction as well. Key points: employee satisfaction affects every aspect of a medical practice from patient satisfaction to overall productivity. Frederick Herzberg theorized that employee satisfaction has two dimensions: hygiene and motivation. Hygiene issues such as salary and supervision decrease employees' dissatisfaction with the work. Herzberg theory. In the late 1950s, Frederick Herzberg, considered by many to be a pioneer in motivation theory, interviewed a group of employees to find out what made them satisfied and dissatisfied on the job. He asked the employees essentially two set of questions. Think of a time when you felt especially good about your job. What did you feel that way? Think of a time when you felt especially bad about your job. What did you feel that way? From the interviews, Herzberg went on to develop his theory that there are two dimensions to job satisfaction: motivation and hygiene. See, two dimensions of employee satisfaction. Hygiene issues, according to Herzberg, cannot motivate employees but can minimize dissatisfaction if handled properly. In other words, they can mishandle hygiene topics include company policies, supervision, salary, interpersonal relationship, and working conditions. They are issues related to the employee's environment. Motivators, on the other hand, create satisfaction by fulfilling individuals' need for meaning and personal growth. There are issues such as achievement, recognition, the work itself, responsibility, and advancement. Once the hygiene areas are addressed, said Hesberg, the motivators will promote job satisfaction and encourage production. Two dimensions of employee satisfaction. Frustration for employees. If the policies are unclear or unnecessary, or if not everyone is required to follow them, although employees will never feel a great sense of motivation or satisfaction due to your policies. You can decrease dissatisfaction in this area by making sure your policies are fair and apply equally to all. Also, make printed copies of your policies and procedures manual easily accessible to all members of your staff. If you do not have a written manual, create one, soliciting staff input along the way. If you already have a manual, consider updating. You might also compare your policies to those of similar practices and ask yourself whether particular policies are unreasonably strict or whether some penalties are too harsh. Supervision. To decrease dissatisfaction in this area, you must begin by making wise decisions when you appoint someone to the role of supervisor. Be aware that good employees do not always make good supervisors. The role of supervisor is extremely difficult. It requires leadership skills and the ability to treat all employees fairly. You should teach your supervisors use positive feedback when possible and should establish a set means of employee evaluation and feedback so that no one feels signed out. Salary. The old adage, you get what you pay for, tends to be true what it comes to staff members. Salary is a motivator for employees, but they do not want to pay fairly. If individuals believe that they are not compensated well, they will be unhappy working for you. Consult salary surveys or even your local helps wanted ads to see whether the salary and benefits you are offering are comparable to those of offering officers in your area. In addition, make sure you have clear policies related to salaries, raises, and bonuses. Interpersonal relationships. Remember that part of the satisfaction of being employed in the social contact, it brings so allow employees a reasonable amount of time for socialization. Example, over lunch, during breaks between patients. Them develop a sense of teamwork. At the same time, you should crack down on rudeness, inappropriate behavior, and offensive comments. If an individual continues to be a disruptive, take charge of the situation, perhaps by dismissing him or her from the practice. Working condition. The environment in which people work has a tremendous effect on their level of pride for themselves and for the work they are doing. Do everything you can do, keep your equipment and facilitates up to date. Even a nice chair can make a world of difference to an individual psyche. Also, if possible, avoid overcrowding and allow each employee his or her own personal space, whether it be a desk, a locker, or even just a drawer. If you have placed your employees in close quarters with a little or no personal space, don't be surprised that there is a tension among them. Before you move on to motivators, remember that you cannot neglect the hygiene factors discussed above.